My name is Paul Schneider. I'm here today with Pastor Simeon Kamadi Jumba from Kisumu, Kenya. What we saw, I've looked at the lab results and we compiled them, and 3 out of every 5 children, their immune system actually strengthened, and they gained, some of them, so much weight. And you said that when they came to be tested at the end of the study, you said they were just totally different children.
The wonder of what happened to these children up to today is an amazement in the villages where these children come from.
Mm-hmm.
Let me say this. We brought in the children for retesting.
Yes.
After the study.
Yes.
And just the people, the officials, the government officials, the lab technologists,
yes,
who were taking the samples for testing, after the test, they looked at them and they were wondering what has become of them.
Wow.
Because one, at the hospital, they try, especially those that are inpatients in the hospital, they try nutrition.
Yes.
They try the antiretrovirals.
Yes.
And it hasn't been like what the SeaBoost has produced. But interestingly enough, I took the results to the director in charge of the International Disease Control Center in Kisumu. When he looked at the results, he was so amazed.
Really?
Because there hasn't been any intervention that has brought about the change in CD4 count.
Really?
The CD4 count differential.
Yes.
As they so say, like what he saw in the children that were on SeaBoost.
Wow. He was so impressed with how the advancement of the children, how much healthier they were, how much weight they had gained, just with their physical health. That we only had 2 children that were still sick out of the 90 children.
Yes, sir.
And so this man was so impressed that he asked us if we could at least continue on with 10 of the children, and that he would greatly discount the testing.
And so I don't know what I'll go back to in Kenya, but I'm excited. But the thing I know is that I'm going into a problem. One, because they would want us to duplicate, because we had told them if the Lord blesses us and if the results are good enough and they're good to help intervene into this children's problem, that we would expand and cover more.
Yeah, and by God's grace, that is what we will do.
Yes.
So when the guardians for the children, when they came with their children for the second testing, how did you see them?
Man, they mocked me, Brother Paul. They came and they told my baby, hold it, do you know this one? Do you know this one? Do you know this one? It was just a scene, and so I held the children. It was it was an experience. I don't know how to explain it, but it was an experience. These people were excited because their children were dying, and now they are alive
and
once
now
again.
You can't even tell they have AIDS.
No, you cannot tell they have AIDS.
That is something.
You cannot tell they have AIDS.
And the children, you told me they were laughing,
running
around the building.
Running around and bouncing and playing like any normal children.
Wow.
Yes.
Wow.